welcome to Helen Herman. Madam President and I worked together many years ago as in the editorial panel of World Psychiatry. We have traveled with Helen extensively, and I wish to thank you, Helen, personally for being present. Many of our younger colleagues may not remember, or perhaps were not even born, when you and Norman Sartorius and other distinguished psychiatrists visited our country at the regional conference of World Psychiatry in 2007. I wish to thank you very much for that. In 2002, and again, I want to thank the World Psychiatric Association and to illustrate the very close relationship Kenya has had with WPA. You remember the launching of APAP in the city of Yokohama in Japan, together with other presidents before yourself. So please accept my personal gratitude for the support WPA continues to offer the Kenyan Psychiatric Association. I have no doubt that this very important relationship will continue. Now, you've said a lot of what, thank you, Helen. You've said a lot of what I had hoped I would be able to say, which makes my presentation exceedingly easy. Next slide, please. So all I am really going to say is, next slide, please, is what has happened in the Kenyan context with respect to COVID-19 and its aftermath. The first thing, and this is the first thing I will say, is that we, Lukwaya Twoli and others who are present today, were ready to release the findings of our task force. COVID happened and there was a delay. The consequence of that delay is that we are forced into writing a postscript that incorporated some things that had happened as a result of COVID-19. Again, we will all remember as Kenyans the very violent implementation of lockdown. My memory goes back to Mombasa, where very hungry and very angry policemen beat people up in the first night of the declaration of the curfew. Families were separated. People worried about their job opportunities. Really, there was a great, next slide, please. There was a lot of angst around the early stages of this implementation. Again, we as Kenyans will remember very painful but necessary measures that were put in place. We couldn't visit our loved ones in the rural areas. And very importantly, and I think this could have happened in other jurisdictions, was the whole thing of a trust deficit between the public. We didn't believe what the government was telling us. There was psychic contagion, very seriously, characterized by communal activity. People were suspicious of each other. Everybody around was infected and was about to infect other people. We all noticed a lack of continuity of care in both private and public spaces. Some of it arising from the fact that we, as mental health workers, and I know Dr. Koba will be talking a little bit about us, mental healthcare workers, and our response. So really, as we had found out from the mental health task force, there was inadequate investment in the whole space of mental health in our country. Next slide, please. So our postscript that came as a result of the delay in the publication of our report. And really, I would really encourage anybody who has not done so to read the report. If I say myself, I think it's a good report. The main body of the report remains unchanged, but the postscript, we take COVID-19 as a reason for us to state that Kenya must act with clarity and speed to implement our findings. I'm very, very, very happy to say that whatever my impressions are worth, it is my impression that the task force report released in July is being taken extremely seriously. And I think in the coming days and weeks, the evidence of the action that is being taken will make itself manifest. Next slide, please. Now, Helen has mentioned the WHO report that was released in May that warned way back in May of an increase in mental health needs all over the world. We have certainly seen in Kenya increased use of alcohol. We did a little survey amongst members of one of the local clubs, and we found that even amongst people who would claim to be well adjusted prior to COVID-19, many of them were using a large amount of alcohol. We've been told about depression, anxiety, and crucially, and this is from the World Health Organization report, the need to flatten the curve with respect to the potential of the development of increased mental illnesses. Next slide, please. So inpatient services in Mathare, we know this, and indeed all over the country, inpatient services were disrupted in part, and this is very interesting. I hope Dr. Kobo will talk about this one, is because we as the front health workers were ourselves unsure as to whether it was safe to come anywhere near a patient. I'll be talking a little bit about the guidelines from the American Psychiatric Association and the Royal College of Psychiatrists about how to conduct the business of being doctors. But the bottom line is that even drug supplies, many of which you get from India and other jurisdictions, were limited in terms of availability. As I say, some units in some hospitals had to be locked. Some because there were just no patients, others because there were no doctors and nurses to work in, and others because they were being used to receive patients who had COVID-19. Next slide, please. So our findings at the task force had demonstrated what you can see from there. There were buildings that we saw in utter shock that were old and condemned by the Ministry of Public Works. The maximum secure unit in Mathare really is a monument of disgrace for all of us Kenyans. Really the environment of the crowding that we found in Mathare was really a perfect environment for the transmission of the virus. And to compound that, we found that people in Mathare did not have any medicines. No haloperidol, no diazepam, no injectable of any sort. We saw that and have recorded that. And Helen has told us that from this recent study, that people with mental illness have a greater vulnerability than others. So next slide, please. And now, just to make our lives even more complicated, are the messages that we were getting. The messages that were supposed to keep us safe are the precise messages that were intended in some ways to promote anxiety and depression. Don't go to church. Don't connect with the spiritual guidance. Don't bury the people that you love. Don't go to school and stay at home and harass your parents, and husbands and wives look at each other in fear and apprehension. So everything that we were doing that was intended to keep us safe in our country went against the very things that we as mental health experts advocate. The consequence of which, as I've said, next slide, please, was domestic violence, poor access to care, and generally increased stress in all medical staff. Dr. Koba will be telling us a little more about that. Next slide, please. However, and this is perhaps where I would like to spend a little more time, is what opportunities are given to us by this COVID situation. In other words, this very dark cloud that is hanging over all of us, does it have a silver lining? And I would submit to you that indeed, at the very least in Kenya, it has. We have all noticed the increased profile of mental health issues within government and the public in general. The Kenya Medical Association, for example, every Tuesday has had a webinar at which a mental health expert or two, sometimes three, have led conversation among the medical fraternity on issues mental health. And I think the silver lining of this COVID thing is that more doctors generally are aware about mental health and mental health issues. Secondly, and this I will say is also true, practices of telemedicine have increased. Very wisely, the Medical Practitioners Dentists Council began licensing doctors and institutions to practice telemedicine for the first time in April of this year. And to my great gratitude, the turnaround time from application to granting the license was not more than 48 hours. Research opportunities, will be told about those ones. Training remotely has become very easy. I was just looking at the number of people in this webinar, well over 100 people attending. A face-to-face meeting would be lucky to attract these kind of numbers of Kenyans to so let's not look at only at the dark side of COVID-19. I actually think that there are a number of silver linings that we could relate to. Next slide, please. And Kenya is a unique country. I'm sure every person would say that, including Ahmed. But our literacy rate is very high for a country such as ours. Internet penetration, you can see, is extremely high. Almost everybody is able to use mobile telephony to exchange money, and social media. So these are opportunities that I actually think that we in this country are being forced to use. Next slide, please. For the simple reason that telepsychiatry, which I am advocating now, is something, next slide, please, is something that we as Kenyans should really embrace very seriously. Has been shown to be effective and acceptable. During this pandemic, the APA released guidelines regularly on how to practice. And very crucially, the Royal College has made a very clear statement that it's equivalent to in-person care in diagnostic accuracy, treatment effectiveness, and patient satisfaction. And very happily for me, the Royal College recommended that if you're 70 or pregnant, you can't be both, that really you should use telemedical practices as a preferred mode of communicating with your patient. And I have to say that for our teams, this recommendation has proved to be very helpful. In particular, the emphasis on the fact that keeping social distance and ensuring that you, the psychiatrist, and your patients are kept safe is your responsibility, not that of any other person. Next slide, please, and I'm coming to the end now. The mental health policy, again, from just interacting with the people that are responsible for implementing this, made certain recommendations. For example, it's possible that they have accepted our recommendation on Mental Health and Happiness Commission. We think that a body such as that would have prepared us well if it existed as a country to confront COVID-19. We also propose that we declare mental ill health as an emergency of epic proportions. We've also recommended, and I remain in deep prayer, that Mathare Hospital will either be pulled down or relocated completely. Either of those ones are one of our recommendations, and I think government could well be listening. Again, look out for this in the next couple of weeks. We also know that Mathare, I think, has already been declared to be a semi-autonomous government agency with its own board and so on. An announcement is inevitable. And Parliament seems very keen to give legislative initiative to criminalize attempted suicide. What am I saying? I'm saying that in the context of, next slide please, of COVID-19, a lot has happened that has raised the profile of mental health in our country. And although this is not a good way, would not have been my preferred way of doing things, it seems to me that we as mental health practitioners have an opportunity to take advantage of this very dark cloud. Next slide, please. So what lessons have we learned as a people of this country? Well, you know what? You can ask anybody from Australia to the UK to America. COVID-19 is democratic. It just catches anybody it likes. It doesn't like tall people, fat people, Africans, Australians, Americans. And that really has convinced those who are in doubt that the earth is one ecosystem. And it gives me great happiness to have our friends, brothers and sisters from other parts of the world in this conference today, emphasizing that issues like infections across the globe and global warming and all other things, no one country can deal with these issues on their own. And remember that you're only as safe as I am. We don't know what economic shocks are on the way, and very sadly, and I say this with sadness about some of our colleagues who have passed on in the course of duty, that death is real, and I think it's very important for us to work in this regard. Do we have a way forward? Next slide, please. Yes. One of the things that are completely clear in my mind is that the future is not clear. And I think that's a good starting point. But we know it is not clear. We think that a vaccine will be available soon. But again, unless we act in a concerted manner, the grabiosis that exist in the current world order could disadvantage those people who are less economically able. I think there was an announcement this morning from the World Bank that I think has offered quite a large chunk of money to increase availability of vaccines to those less able to get it. So even as we battle this COVID-19 and its consequences, I think the opportunities presented in our country today include the opportunity to survey mental health consequences, a bit like Graham Thornycroft was suggesting in his since aborted presentation, which I'm sure we'll be hearing shortly, just so that as we move forward, we have a very clear idea of the extent and severity of the challenge before us. Ladies and gentlemen, I must thank you for your very kind attention. I will be happy to accept any easy questions. That is a picture of where I am right now. The top hand right corner is the Chiromo Mental Health Hospital.